First of all, thank you, Connie and Labona, for sharing your story. I can't think of a better way of expressing what's at stake in this fight and what's possible. Thank you. Your Excellencies, distinguished guests, ladies and gentlemen, welcome to the Global Fund's 6th Replenishment Conference. Je remercie tout particulièrement la France, Monsieur le Président Macron, Madame la Ministre Buzyn et Monsieur le Ministre Le Drian, ainsi que le maire et la ville de Lyon, pour nous accueillir ici et pour tout l'appui qu'ils nous ont donné au cours de la campagne de reconstitution des ressources. We have a full and exciting agenda for the next 24 hours. I am confident that we will have much to celebrate tomorrow. But while a successful replenishment is itself an achievement, what really matters is the impact we deliver with these resources, the lives we save, the infections we prevent, the impact on individuals, families, and communities. To achieve the SDG 3 goal of ending the epidemics by 2030, we must step up the fight. Huge progress has been achieved in reducing deaths from AIDS, TB, and malaria. The Global Fund Partnership, as you've heard, has saved 32 million lives and cut the annual death rate by more than half. Think about that for a moment. Based on our 2018 results, together we are saving over 450,000 lives a month, nearly 15,000 a day. Yet despite such progress, we're not on track. Drug and vector resistance, stagnant funding, environmental changes and conflict have knocked us off course. So we face a choice. Do we step up? Or do we slip back? Against adversaries as formidable as HIV, TB, and malaria, there is no middle ground. We're either winning or we're losing. Through the decisions you who are donors are making on this replenishment, you're making this choice. Through the decisions you who are heads of state and heads of government, the decisions you're making about the financing of health in your countries, you're making this choice. To put this moment, these decisions in context, think back where we have come from. The world was a very different place in 2002 when the Global Fund was founded. Since then, the probability of a child surviving to the age of 7, Labona's age today, has nearly doubled. Back then, less than 1% of pregnant women in Eastern and Southern Africa received treatment to prevent transmission of HIV to their baby. Today, more than 90% of pregnant women in this hard-hit region receive such treatment. Deaths from malaria, largely children under 5, have almost halved. The result in large part due to scaling up distribution of insecticide-treated bed nets and expanding community health worker networks to provide diagnosis and treatment. It's not just infants that have benefited. Today, an individual diagnosed with HIV is 64% less likely to die from the virus than in 2000. A TB patient is 30% less likely to die. A malaria patient is 45% less likely to die. But while we have made huge progress in reducing the deaths from these 3 diseases, far too many are still getting infected. To end the epidemics and thus save countless future lives, we need to achieve a dramatic reduction in infection rates. Stepping up the fight on prevention will require us to accelerate the deployment of new innovations, collaborate with an even broader range of partners, and use data even more intensively to target interventions and quickly scale up what works. Today, as Connie mentioned, nearly 1,000 adolescent girls and young women will become newly infected with HIV. In sub-Saharan Africa, twice as many girls and young women are infected with HIV as their male counterparts. And in the hardest hit countries, it's 6 times more. Achieving our target of more than halving this shocking rate will entail more than access to condoms, more than deployment of medical interventions such as PrEP, more even than comprehensive sexual and reproductive health education. It will require tackling the underlying gender inequalities that make young women so vulnerable. Programs to address gender-based violence, educational disadvantage, economic disempowerment. In the next phase of the fight, we must even more deliberately leverage the synergies between the fight against HIV, TB, and malaria and the overarching goal of SDG 3, health and well-being for all. We will step up our investment in building resilient health systems, supply chains, data systems, community health workers, laboratories, disease surveillance. We will increase the focus on packages of patient-centered care, whether it's the HPV vaccine combined with HIV prevention, nutritional supplements with seasonal malaria chemoprevention, or TB prevention for HIV-positive patients. And beating HIV, TB, and malaria will itself create capacity in overstretched primary care systems. As a partnership, we can also do more to capitalize on the interconnected nature of the other SDGs. For example, SDG 4, education for all. Today, up to 50% of preventable school absenteeism is caused by malaria. So cutting malaria improves education. We also know that keeping girls in schools reduces their vulnerability to HIV infection. In this way, education and health reinforce each other. Also, SDG 5 on gender equality and SDGs 10 and 16 on inequalities and justice. Dismantling gender and human rights-related barriers to health is critical to ending the epidemics. Without such action, even the best biomedical interventions won't succeed. Ultimately, we're talking about SDG 1, no poverty. HIV, TB, and malaria can be both a cause and consequence of poverty. So the economic returns from tackling them are incredibly high. $19 to every dollar invested. Making this happen will take more money. That's why we're here. But it's not just about money. It's about innovation in drugs, diagnostics, but also in the way we work, how we use technology, how we work with communities or the private sector. We must shorten the cycle time between the spark of a great idea and it being used at scale to benefit the people who need it. It's about collaboration with governments, with our multilateral partners through the Global Action Plan, with our key bilateral partners, such as PEPFAR, PMI, DFID, and AFD, our partnership with NGOs, civil society, and communities. It's about people and leadership. The courage of political leaders, such as those in this room, the determination of community leaders and people living with the diseases to fight for their rights, the passion of frontline health workers who put their heart and soul into caring for their people. This is not a time to be incremental. It's a time to be bold, to step up the fight. We have cut the mortality rate from HIV, TB, and malaria by more than half since 2002. If we step up, we can cut it in half again between now and 2023. In 2017, 2.5 million people died from HIV, TB, and malaria. By 2023, the annual death toll should be down to 1.3 million. Still too high, but that is a very significant reduction. Yet in order to end the epidemics, we must also accelerate progress in preventing new cases and infections. Across the three diseases, the incidence rate fell by more than 1/3 between 2002 and 2017. By stepping up the fight, we can achieve another 1/3 reduction in incidence by 2023. We have saved 32 million lives as a partnership in the first 16 years of the Global Fund's partnership's existence. In the 3 years funded by this replenishment, we aim to save another 16 million. And by accelerating the reduction in new infections, getting back on track towards ending the epidemics, and thus saving countless millions more. None of this has been or will be achieved by the Global Fund alone. But the extraordinary partnership represented by the people in this room and by our many friends and partners elsewhere can make it happen. Ending the epidemics of HIV, TB, and malaria is within our reach, but it's not yet firmly in our grasp. Together and today, we must seize this opportunity, take on the challenge, and step up the fight. Together, we can fulfill our promise to the 7-year-olds of today, like Lobono, that the world they inherit when they become 18 in 2030 will no longer be a world ravaged by HIV, TB, and malaria. Thank you.